Hi, my name is Nicki. I'm the nurse practitioner student who is here to evaluate the 25-year-old female Caucasian with complaints of left-sided shoulder pain today. Hi, Melissa. I'm Nicki. I'll be the practitioner doing your evaluation. What brings you to the office?
I've had shoulder pain for the last 3 days.
Has that radiating anywhere?
No.
Do you notice it came on when you were doing any certain activities?
I was playing softball and throwing made it a lot worse.
Okay, has this happened before?
No.
Does it radiate just to the left side, you said, right?
Just on the left side.
What would you rate your pain on a 1 to 10?
About an 8.
Does anything make it worse or better?
Sleeping at night makes it worse. And,
Okay.
overhead motions.
So daily activities are difficult with that left side?
Yeah.
Okay. Well, have you tried anything at home to make it better?
Tylenol, ibuprofen, ice.
Nothing's worked? Okay. What about travel? Any recent travel?
No.
Have you been around anybody who's been sick?
No.
Any medications you've been taking?
No.
So no medications, we can rule out any possible side effects of medications. What about your medical history? Anything outstanding in your medical history?
I've had surgery on my ankle
Any complications?
No.
How long ago was that surgery?
about 6 years ago.
What happened to your ankle?
I broke it playing softball.
Playing softball. Okay. Well, what about your family? Everybody in your family healthy? Any history of arthritis or hypertension
On my dad's side, yes.
on your dad's side? What about your mom?
No, she's just alive and well.
Okay. And your siblings? Are they alive and well as well?
Yes.
And grandparents? What about them?
Yes, alive and well.
Okay. And social, what do you do for a living?
I'm a student.
And social activities, I know you play softball.
Play
Any
softball.
other jobs that you do that involve the overreaching movement of your both arms or shoulders?
I watch kids
Okay, so got kids pulling on you all day.
sometimes.
Okay. All right. Well, what about smoking and your alcohol intake?
I don't smoke and I occasionally drink a glass or two.
A week, a day?
A week, maybe.
Okay, a glass a week.
Yeah.
All right. Well, so we've run through your medical, surgical medications. If you took anything, your family history. So now we'll move on to our assessment. So on assessment of your anterior torso, I'm inspecting your shoulders for symmetry and disconfigurations, swelling, any ecchymosis purpura, abrasions, lesions, dislocations. And on the left side, I do see some mild effusion here, right under the acromion. That seems to be tender, yeah?
Yeah.
And the left side is abnormal compared to the right. For purposes of the video and time's sake, everything on the right arm will be normal upon all assessments. I'll also compare it to the posterior. So I'll have you swing your legs around. Again, on assessment on posterior torso, on the upper shoulders, I'm looking for any asymmetry, bulging, protrusions, swelling, discoloration, ecchymosis purpura, abrasions, lesions, and that is not seen on this patient. Again, there is some swelling on the left aspect of the acromion process that is tender upon palpation compared to the right. I'm also going to palpate while I'm back here after I've inspected. I'm going to find the scapula here, the medial process, and move my fingers upward to find my landmarks, noting any crepitus, tenderness till I get to the acromion process. Just below the acromion process is the subscapularis. I would push on and see if there's any tenderness here. Also, we'll assess for the sits muscles or the subclavicular muscle. You have your supraspinatus up here at the top, your inferior spinatus, and your teres minor that we would compare bilateral. Any tenderness on the supraspinatus on the left side compared to the right?
A little bit.
Worse on the left side?
Yeah.
What about here? A little bit on the left?
Yeah.
What about the right?
No.
No. And the teres minor, any tenderness on the left?
No.
And what about the right?
No.
All right, so the patient complained of tenderness mainly on that upper compared to the lower part of the muscles on the scapula. So we'll again have you swing your legs to the front. So again, our focus is going to be on the left arm on assessment. We'll also palpate here the subscapularis, see if there's any tenderness, little tenderness. I'll find the acromion process. Again, here find that notch between the clavicle. Follow the clavicle down, note any crepitus or discomfort. Any tenderness? Not really?
Not really.
Okay. And again, I would compare to the left. or the patient's right. And again, the right is all normal for purposes of this video. I'll go ahead and have you swing your legs sideways. So while I'm feeling for any warmth, crepitus, tenderness, pain, increased pain. And we'll also find the bicep muscle here, kind of push on that bicep muscle. There's some tenderness there.
A
little bit. And then if we're trying to rule out or we think it's bicep tendinositis, we might find this occipital groove where the insertion site is and push on that. Is there any increased pain?
No.
Not really.
Not really.
But tender?
Tender.
Okay. And then we'll also, again, we've already palpated the subacromial process. A little bit of tenderness there. Yeah. All right. So that was our palpation assessment. And now we'll also do some range of motion exercises. Okay. So I'll go ahead and have you stand up. So we'll just start with some basic range of motion exercises. I'll have you flex forward here and then extend your arm back. Have you turn sideways for everybody here. So extend your arm back and then again flex forward. And then again as I feel for any crepitus or warmth. Alright, flex forward. I am noting some crepitus here in the shoulder. Now we'll go ahead and have you face forward. We're going to abduct your arm laterally and adduct. Okay, we're going to do some internal rotation. We're going to do 90 degrees. And here, noting for any crepitus or increased pain. A little bit. Okay. Now we're going to hold your arm up, and we're going to dangle down and dangle up. Any increased pain? Yeah. All right, so we're going to do some specialty tests now that we've gone through the simple range of motion test. We're looking for any impingement, inflammation in your tendons or your muscles. So first we'll start with the drop arm test. And that one I'll have you laterally abduct your arm as far as you can and let me know if pain increases as you go higher. Alright, so this is the pain arc test. Getting worse? Yeah. Alright, now go ahead and lower it by yourself. And try not to drop that arm. So patient does have a positive drop arm test. That could be indicative of maybe a muscle irritation or a tear. And we'll also do another exam with your both arms. We'll have you come up with thumbs up. And I'm going to apply some pressure. This is a speeds. I have some left side weakness compared to the right. And that is a positive test for the speeds test. We'll also do the empty can test. This is supraspinatus exam for possible supraspinatus tear or some other rotator cuff tear. Now I'm going to apply some pressure. And then again, we have some muscle weakness. Increased pain when I do that?
Yes.
Yeah, so patient does complain of pain, and there is left side weakness on that exam. And we'll also do what we call the nearest test. This is also checking for any type of impingement here in your shoulder. So with your thumbs up again, I want you to come all the way up with your arm to your ear.
That hurts.
It hurts? All right, go ahead and lower it back down. Okay, now we're going to do the Hawking's test. This is again also checking for impingement or irritation here in your shoulder. So I'll go ahead and have you chicken wing for me. And I'm going to push here. Any pain?
Yeah.
Yeah. So that is also a positive Hawking's test. So we've done the Hawking's and the nearest for specialty. We're also going to do the Berger's test or the lift-off test. So I'll have you turn with your back like this.
Okay.
And then with this arm, I want the palm or the back of your hand to the small of your back.
Okay.
And see if you can lift off. Any increased pain?
No.
Good. Some tenderness though?
A
little bit.
A lot.
So patient was able to perform the lift-off test with internal rotation. We'll also do external rotation or a part of the Apley's test. Have you reach over your shoulder and try to scratch your back. So patient unable to completely perform this exam, go ahead and turn around for purposes of the camera. Can't fully externally rotate that shoulder. All right, go ahead and relax. And now go ahead and face here, and we're gonna cross and touch your shoulder. Any increased pain?
Slightly, but.
Okay, so go ahead and relax. So now we're going to do the the Jaegerman's test, or the RC testing. So this is again testing for your rotator cuff. I want you to try and externally rotate, or supinate, if you will. So open your arm up, and I'm gonna resist you here. Alright, and so go ahead and try that again. I'm trying to feel for popping, clicking, that would be indicative of some irritation or subluxation upon supination or increased pain. Any increased pain when we were doing that? No. Okay. So those are most of our exams. We've got one more for you. I'm going to have you lay down, and this is going to be checking again for subluxation. Make sure that the laxity in your joint isn't too much. Maybe your shoulder's popping out of place.
Okay.
So I'll go ahead and have you lay down first. So again, this is checking for shoulder stability. This is the apprehension and relocation test. Patient should have decreased pain if I am to relocate the shoulder. So in apprehension, I want to go ahead and take this here, extend, and we'll go ahead and relax your arm at 90 degrees. The patient didn't really show any signs of apprehension, but now I'm going to put some pressure here. And does it make the pain worse or better?
No.
No, not really? So your pain doesn't go
constant.
away, just constant pain. All right, so we do not exactly have a positive test on that, but doesn't completely rule out subluxation or dislocation of the joint. So upon assessment of this patient, my 3 differential diagnoses would be the rotator cuff tear, a bicep tenosynovitis, or a glenohumeral instability. And thank you so much for your time.